Hey, I'm Dr. David Seji at Momentum Chiropractic in San Luis Obispo, and today we're going to talk about sciatica. Now, there's a lot of misconceptions on what actually sciatica is. To be specific, your sciatic nerves stem from your low back and travel all the way down to your feet. They're what control your ability to use your legs in the first place. And you can also have something called sciatic pain, sometimes just called sciatica. Now, sciatica tends to happen when the nerve is getting irritated. Now, think of a nerve like a giant hose, right? It can get kinked in multiple spots. The most common spot is where it starts, where it's the thickest. And where it's the thickest is exactly at the low back. If the low back bones are twisting or you have a bulging or herniated disc, that can choke the nerve and cause decreased nerve flow down your leg. Then the alarms go off. There's pain saying there's something wrong with the nerve. But you might not feel it directly in the low back where it's causing it. You may feel it in the side of the leg, the knee, all the way in the calf, even into your foot. This is all considered sciatica pain. Now, in order to find out exactly what the cause of this problem is, we need to look closer. First thing we need to do is a careful evaluation, examination, and take x-rays. We need to see what's going on, especially with the spine and where the nerve starts, and make sure we can put together a plan to get it all shaped up and you taken care of with either chiropractic adjustments, massaging out the muscles in there, or decompressing the discs that have started to get squished in the spine so that we can get that nerve as healthy as possible and get you feeling your best, get that tingling, that numbness, that pain out of your legs so that you feel great and you can do everything you love doing.